Monkeypox is a viral disease that affects both humans and animals. It is a type of orthopox virus, which is a family of viruses that includes smallpox. This means it is related to smallpox, but it is generally milder and less deadly. Monkeypox was first discovered in monkeys in 1958 during a study of captive monkeys. The first human case was identified in 1970 in the Democratic Republic of Congo, marking the beginning of our understanding of the disease in humans. Monkeypox is a zoonotic disease, which means it can be transmitted from animals to humans. This transmission can occur through direct contact with the blood, bodily fluids, or cutaneous or mucosal lesions of infected animals. It is mostly found in Central and West Africa, where it is considered endemic. However, outbreaks have occurred in other parts of the world, often linked to international travel or imported animals. Monkeypox is a rare disease, but it can have significant health impacts. It is important to be aware of it and understand its symptoms and transmission methods. Understanding monkeypox can help us prevent its spread and protect public health. Monkeypox spreads in a few ways, and understanding these can help in prevention. It can spread from animals to humans, which is known as zoonotic transmission. This happens through direct contact with infected animals. These animals include rodents and primates, which are common carriers. Monkeypox also spreads from person to person, making human-to-human transmission a significant concern. This can happen through direct contact with an infected person. This includes contact with bodily fluids or sores, which are highly contagious. It can also spread through respiratory droplets, especially when an infected person coughs or sneezes. This usually requires close contact, such as living in the same household or being in crowded places. Indirect contact can also spread the virus, making hygiene crucial. This includes touching contaminated materials like bedding or clothing, which can harbor the virus. Pregnant women can transmit the virus to their fetus, posing a risk to unborn children. Once inside the body, monkeypox virus starts to replicate. It targets skin cells. It also targets cells of the immune system. The virus multiplies within these cells. This leads to cell damage and death. The incubation period is about 1 to 2 weeks. This is the time between infection and symptoms. During this time, the virus spreads in the body. It can affect multiple organs. The virus triggers an immune response. This causes inflammation and the characteristic rash. Section 4. Recognizing monkeypox, signs and symptoms. Monkeypox often starts with flu-like symptoms. This includes fever, headache, and muscle aches. It can also cause chills, exhaustion, and swollen lymph nodes. A rash usually appears 1 to 3 days after fever. The rash starts as flat red spots. These spots turn into raised bumps. The bumps then fill with fluid and pus. The rash can appear anywhere on the body. It often starts on the face and spreads. The rash eventually scabs over and falls off. Section 5. Diagnosing monkeypox, tests and procedures. Diagnosing monkeypox can be challenging. This is because its symptoms are similar to other diseases. These include chickenpox and measles. Doctors will consider a patient's history. This includes travel history and possible exposures. A physical exam will be done to check for the rash. Laboratory testing is needed to confirm the diagnosis. This usually involves taking a sample from a rash lesion. The sample is then tested for the presence of the virus. Section 6. Treating monkeypox care and management. There is no specific treatment for monkeypox. However, there are ways to manage the symptoms. Treatment is mainly supportive. This includes rest, fluids, and over-the-counter medications. Antiviral medications may be used in some cases. These can help to reduce the severity of the illness. This is especially important for people at risk of complications. Preventing dehydration is important. The rash should be kept clean and dry. Complications from monkeypox can occur. These include skin infections and pneumonia. Section 7. Staying safe. Prevention and future outlook. Preventing monkeypox is crucial for maintaining public health and safety. Avoiding contact with infected animals is key to reducing the risk of transmission. This is especially important in areas where the virus is common, such as certain rural communities and regions. Good hygiene practices are essential in preventing the spread of monkeypox. This includes washing hands thoroughly with soap and water for at least 20 seconds. It also includes avoiding contact with potentially contaminated materials and surfaces. Vaccines developed for smallpox can provide some protection against monkeypox, offering a valuable tool in prevention. These vaccines are used in certain situations, particularly for those at higher risk. Continued research is important for developing better treatments and more effective vaccines. By understanding monkeypox and staying informed, we can all do our part to stay safe and healthy. Let's work together to prevent the spread of this virus and protect our communities.